Botox is the injection of botulinum toxin into the facial muscles. Typically, we inject it into the facial muscles of expression. Weakening these muscles means there will be less movement of the skin, which by consequence means you have less lines on the skin. Botulinum toxin injection has been in existence for several years now, and it's very safe procedure, and the pain factor is very little, if any. The area between your eyes is a frown area, or the frown line, which are these two vertical lines that you get when you bring your eyebrows together. The two muscles responsible for this movement are the corrugator muscles, which is the one that is just runs parallel to the eyebrow on either side. So you see that from here to here is this muscle, and from there to there is another muscle. You see when you contract it, these two muscles contract towards the center, and as they do so, they create this line. So you can see this line we're talking about there, like that. And that's a lifetime of doing this is guaranteed to cause lines, these two lines here. Also, another line that you get in the area of the frown is the horizontal line, and that is caused by the contraction of a muscle that runs from here to here. It's called the procerus muscle. So this muscle runs straight from the forehead to the bridge of the nose, and when it contracts, it brings the skin together there, and that is what causes this line, this horizontal line, and that also is treated by Botox. We will now focus on the forehead, which is the next area of concern. So without Botox, normally what happens is we're able to move our eyebrows up, and when we move our eyebrows up like that, you get the horizontal lines. Those horizontal lines over time become engraved in the skin, and they become like worry lines, all right, or lines of wisdom, people will say. When the muscle that connects the bridge of the eyebrow to the liver scalp contracts, that's how this line forms. So Botox works by also weakening that muscle and making this movement less prominent, and yet as a result the lines are reduced. Next, we're going to focus on the other lines of interest, which is the crow's feet, which are the lines that radiate from the outer angles of the eye on both sides. It is caused by a number of factors, but mostly the contraction of the muscle that controls the movement of the eye. You have this cycle of muscles called the orbicularis oculi, and the fibers that run this way run up and down from the eyebrow to the lower aspect of the eye. And when this contracts and brings the skin there together, that line is formed. And when you do that for a lifetime, you have lines that do not resolve with the resolution of the movement. And with time, when we smile, our cheeks go up. When our cheeks go up, that also increases, brings the line about. So what Botox is able to address is the part of it that is caused by the contraction of the orbicularis oculi muscle, this one here. We're able to inject Botox there, weaken that, and make that line less prominent. Botox will not be able to eliminate the line that is contributed to by the elevation of the cheek, because the Botox will not prevent you from elevating the cheek. We also inject Botox in the lateral aspect of the eyebrow, right about there, and depending on how it is injected over there, you may get an elevation of the eyebrow. Some patients like this, some do not like it. So it's important to ask the patient what his preference is before the injection is done.